Was there anything that surprised you about this that you kind of weren't expecting?
I would say like two-thirds halfway through the procedure, there was that pain when he moved to the front of the nodules.
Mm-hmm.
Now, obviously, with the lidocaine, I was like, oh, it's going to be kind of like just going and getting a cavity done at the dentist. I didn't really understand how that could change. Obviously, so when he moved to the front nodules, and it was significantly more painful, and I did have to count through the 8-second intervals. I will say that sort of going through that portion of it.
Yeah.
Now, talking about that, I wouldn't want that to scare anybody, because I'm pretty certain, because he definitely mentioned that they were talking about doing more sedation, offering more things to help. So I wouldn't let that put anybody off of nsPFA. But I would want to say, like, yes, there is a portion of it if your nodules are at the front.
Yeah.
And things like that. Be aware of that. So that one definitely caught me slightly off guard.
Regarding the sedation point you mentioned, I've actually been told they're doing these procedures with the option of sedation, but what they're talking about doing with nsPFA patients now is kind of like what you would have with a colonoscopy, where you don't really remember it afterward. And what I've been told is that for the patients that find the pulses a little bit too much for their anxiety, that is a very good option. And it's actually quite affordable and covered by insurance is what I'm told. So obviously everyone's insurance will be different, but we have experience with that in the colonoscopy sedation world that a lot of patients have experience with as well. And so they know a lot of patients know what that is like. And so sometimes patients are a little uneasy about sedation, and then you tell them, oh, well, it's like this. And they're like, I think I can do that. So
yeah,
that would be a tip for patients as well.